Good evening, everyone. So, after a long time, we have gathered here again to continue our series on the Organon. So, the last time we were talking about the local diseases, the diseases which appear on the skin, why they appear, how they appear, and what should not be done in such cases, along with the homeopathic treatment which we have to do. We were talking about that. So today we will continue more about the same thing for few more aphorisms. Just a minute. Yes. So we will continue from we have done up till aphorism 198, and we will continue from there with the aphorism 199, and we'll try to complete it till 205, where there will be this introduction to the miasms, uh, how the miasms they basically play a role in the continuity of the chronic diseases. We will talk about that thing also. Although we have talked about this thing in our previous lecture on Sora, we have talked in detail that how the Sora it basically progresses, how it starts taking the roots into a person, and how it makes the person sick, and how it is basically a root to the chronic diseases. We'll talk in brief about that today. So aphorism 199. If the remedy perfectly homeopathic to the disease had not yet been discovered, at the time when the local symptoms were destroyed by a corrosive or desiccative external remedy or by the knife, then the case becomes much more difficult on the account of the too indefinite, uncharacteristic, and inconstant appearance of the remaining symptoms. So, Dr. Henneman, he's trying to tell us that if we have not yet found a homeopathic remedy, like if the local symptoms they were destroyed by some kind of local treatment, or some kind of desiccation, or some kind of the removal was done by the knife, or some kind of operation, if the local symptoms are disappeared and the homeopathic remedy is not find the perfect homeopathic remedy, then it is become this kind of case, it becomes very difficult. Then the case becomes much more difficult on account of the too indefinite, uncharacteristic symptoms. As we have done understood it before and discussed it before also, that in such cases, the cases where the disease is local, where the disease is on the external sphere of the body, on the skin, that appearance or the characteristic of the lesion or the eruption, that is what basically defines which homeopathic remedy has to be given. So that symptom in itself is very important. So when that symptom is removed, because in most of the skin diseases, like if you see, if you have some patients who have some skin troubles from a very, very long time, like that skin trouble, it came as an initial disease when the whole disease started, and it has never gone. So in such cases, although they have been taking too much of treatment, the symptom is still there, because the body basically, the vital force, it tries to keep the disease in a more external part so that the disease does not develop internally. That is the way, that is a defense of the vital force, where the vital force is of more resistance, is more strong, it will try to keep it in a more outer part. So in those cases, in those patients, you will also see that there is very less internal diseases or internal symptoms which have developed. You will rarely see such cases that they have developed some kind of diabetes or hypertension or some kind of internal ulcers or some other kind of structural diseases inside. You will very rarely see in them. The people who have been having skin disease from beginning, and they still have that it was not treated. It was not treated properly. It was, it was not suppressed by the local. You will see that their vital force has a strong resistance, that it has not let the disease travel inside. Dr. Hahnemann will speak about it in coming aphorisms. But when it is gone, like if the vital force cannot produce much resistance, it gives into such kind of treatment and it is gone, then we are not left with anything, because homeopathic prescription basically depends upon the characteristics. Anything which makes the disease individual, that is where we have our remedies basically hidden. We have to find our remedy from that part. So when that characteristic part, which in such cases is in a form of local symptom, the kind of like, and day before yesterday I had a patient, the lesions or the eruptions, they were of purplish kind. The color was purplish, the bluish reddish color was there. So that is a characteristic thing. If it would have been treated with some kind of local ointment and I would not have seen it, or it has been gone, then we will not be able to give a perfectly homeopathic remedy which can cure this thing. So similarly, in those cases where the homeopathic remedy was not found and the symptoms, they were destroyed by such kind of treatment, then the case becomes very, very difficult to prescribe upon, because there are no uncharacteristic symptoms. And the symptoms, even if some symptoms are there, they are of very inconstant appearance. They come sometimes, they are not there sometimes. So for what might have contributed most to determine the selection of the most suitable remedy and its internal employment until the disease, everywhere in the cases, in these aphorisms, where Dr. Hahnemann is talking about the local diseases, the diseases which come on the skin, he makes sure to tell the reader, to tell the physicians how the medicine is to be employed, the internal employment. The medicine has to be given internally, not externally, everywhere. So he has continuously told in the previous aphorisms not to use any kind of treatment externally. Why? He has told us. And on the contrary, he has told us in all the other aphorisms to give an internal remedy, which is most suitable, which is most homeopathic. And its internal employment until the disease have been completely annihilated, namely the external principal symptom. So this skin symptom, this local symptom, it was the principal symptom. It was the main symptom from where the entry to the case was done, from where we would have to make sure that which remedy is to be given. So when that principal symptom is destroyed, it becomes very difficult to prescribe in that case. So in such cases, then we have to wait for a long time for again a new set of symptoms to come up, so that we can decide upon our remedy. But during that time, during those 6 months, during that 1 year, 2 years, the disease has progressed a lot. So basically we have lost our chance to cure the patient where it can be cured very quickly, and we have given the time to the patient for the disease to develop. So aphorism 200, had it still been present to guide the internal treatment, if though a symptom was still present, if it was not destroyed, if it was not, removed by some kind of operation or some kind of, mechanical means, if that symptom would have been there, had it still been present to guide the internal treatment, if it had been present to search for the homeopathic remedy, the homeopathic remedy for the whole disease might have been discovered. So if that symptom would have been present and we would have discovered the homeopathic remedy, and has that been found, the persistence of the local affection during its internal employment would have shown that the cure was not yet completed. So if we have given a homeopathic remedy, if that symptom, now how that symptom guides us? It guides us in two ways. The one is to search for a homeopathic remedy. It becomes a characteristic symptom which helps us to find a homeopathic remedy. And in second, when the local affection is not going away by giving an internal medicine, when we are giving an internal treatment and the local affection is not going away, it is persisting, then it shows that the cure is not yet completed. So in second instance, it also tells us the persistence of the local affection, the persistence of the local eruption or local malady, that the internal disease is still there. If we apply something on it and it disappears, we are not sure that the internal disease is gone or not, whether the psora has been cured or not, because then it will show in some other kind of symptoms. So even the presence of such a symptom, if it has been not cured, it can also tell us that the internal employment of the remedy, whichever we have given, it has not yet completely cured the patient. But were it cured, and if it is cured by the homeopathic remedy, by the internal treatment, on its seat, this would be a convincing proof that the disease was completely eradicated. Because we have not applied anything on it. It came from the internal disease, and when it goes away, that can be a convincing proof that the internal disease has also gone away. Because the internal disease was the causation for the occurrence of it and for the persistence of it. It occurred because of that internal infection and it persisted because of that internal infection. So when it is gone, it becomes a convincing proof that the disease is completely eradicated and the desired recovery from the entire disease was fully accomplished. An inestimable, indispensable advantage. So even if it is not getting cured, it gives us an advantage to know whether our remedy is right and wrong, towards which direction the cure is going on. So aphorism 201. It is evident that man's vital force, when encumbered with a chronic disease, which it is unable to overcome by its own powers. We have already established in the previous aphorisms where Dr. Hahnemann tells us about the vital force. That vital force, when in a healthy state, it provides health, a harmony to the body. But when it is weakened by some chronic disease, by some kind of acute disease, then it does not have the power to overcome it. It cannot overcome it, it cannot cure it. It will always need a physician which can help it to cure the patient. But on its own, whenever it is affected by some kind of chronic diseases, it is not able to overcome it. So the same thing is told here, that it is evident that man's vital force, when encumbered with a chronic disease, which it is unable to overcome by its own powers, adopts the plan of developing a local malady on some external part. That is why in any kind of miasmatic start of a chronic disease, the first symptom is always on the skin. In psora, that itch, it comes on the skin. In psychosis, that gonorrhea, it comes on the skin. And in syphilis, the chancre, the ulcer, it comes on the skin. Because whenever some chronic disease starts because of the miasm, because of the internal disease, the first, when the vital force is not able to repel that disease and that disease is becoming stronger, the first defense which the vital force produces is that it adopts the plan of developing a local malady. There's a plan. There's a genetic plan inside the body that whenever it is attacked by a disease, the first symptom, they will appear locally on the skin. That is how the vital force basically intercepts the development of the disease. Solely for this object, that by making and keeping in a diseased state this part, which is not indispensable to human life. Skin is, it is an important organ, very important organ, but it is not indispensable to the human life. It is not that whether if the disease comes on this part, that something danger or dangerous can happen to human life. Okay, it is not like this. We have more vital organs which are inside the body. So this is the most outer part. So the body, sorry, the vital force and the body, it basically tries to keep the this disease on the most outer part of the body, which otherwise threatens to destroy the vital organs. But if the vital force has not done what it is meant to be done, then the same disease can go more deeper and can threaten and destroy the vital organs on which our life depends, which are very vital for our life, and to deprive the patient of life, and that it may thereby, so to speak, transfer the internal disease to the vicarious local affection and, as it were, draw it thither. So what is this vital force? What does it do when it is attacked by the chronic miasms? That it tries to keep the disease on the external part, on the external this thing, because this disease, if it is let loose, if there is no control or no pressure is exerted by the vital force against it, against the attack, then it may destroy the life of the patient. It may become so dangerous that it can affect the vital organs and the life can be taken away from the patient. So the best way, according to the intelligence of the vital force, is that to keep it on the local part, to keep it in the outer part and just let it be there. That is why I was telling that there are many, you will see many patients. I have seen many patients, who are suffering from skin disease from past 30 years, 40 years of their life, 20 years of their life, and very few symptoms have developed inside. Although the outer one, the skin problem is not gone, like someone suffering from psoriasis, eczema, dermatitis from a long time. So their body, the defense has been so much persistent that it has not let it break through the skin. Although the new parts of the skin may have become, affected, like it started from elbow, then it went on to the skin, then to the chest, then to the back. So that shows that, that the disease has increased. But although with the increase of the disease, the vital force has kept it on the external part of the skin. Just think, if it would have spread into the internal part, how would it have spread? With how much force, with how much energy it would have spread inside if it was not kept outside on the local part. So the presence of the local affection thus silences for a time the internal disease. So this presence of local affection, what it does is it silences the internal disease. The progression of the internal disease is basically halted. So without being able either to cure it or to diminish it materially. But the vital force, it does not have the power to cure it or to reduce it or to diminish it. The local affection, however, is never anything else than a part of the general disease. Like we were discussing last time also, when we had this thing, we had this class, that the local affection, the skin diseases, it is mostly sensed as something which does not belong to the internal part. It is something external. If we remove it, it is gone. Usually it is think of like that. But we have to understand, as a homeopath, as a physician, that it is not some different thing and should not be treated differently. It is the part of the whole. It is a small sign and symptom which the body is showing that it has started getting diseased. So we should not take it in a lighter way. We should give it very importance, because this is the first barrier. If it goes past that barrier, then it will start developing internally. So the local affection, however, is never anything else than a part of the general disease, but a part of it increased all in one direction by the organic vital force. So the vital force, it has done, that whatever the increase in disease has happened, it has thrown it out on the external part and transferred to a less dangerous external part of the body in order to allay the internal ailment. So to decrease the internal ailment, it has just thrown it out on the external part. But as has been said, by this local symptom, that silences the internal disease. So that is why we say that suppression of some skin disease is a very dangerous thing. And in such cases where the suppression has been done, and then some disease has progressed, and when you give a homeopathic remedy and that disease started getting better and the reappearance of some skin symptoms come, that is a very good thing. It's a very good sign. Today there's this lady who has been taking this treatment from me from past 1.5 year. She's a doctor herself, and she has been taking this medication for the gastric ulcers. She has a very strong dyspepsia and gastric ulcers, some problems with her urinary bladder, some problems with the menstruation, and another many small problems she had. And she has been getting better from past 1 year. She has been getting better. Some symptoms have gone, some old symptoms have come up. So today she sent me the picture that, doctor, I have started getting this eruptions and acne on my face. So I again asked that, like previously, did you used to have? She said that my whole problem started with this thing. That in my teenage, when this thing started, and I started taking treatment for it, then I started feeling this, this dyspepsia and my disturbance in menstruation. Said that at that time it used to be very bad, so I had to take many kind of treatments for it. And after that, I have started feeling that all these problems which I had has started. So when you see such cases and you go through the Organon, you see the similarity. You see the same thing which is written happening in front of you. That yes, the patient has told this thing that, and we have seen, the patient has seen, we have seen, and then when they start getting better, the reappearance comes, the same kind of symptoms. The same kind of symptom coming up mean that it has never gone. It was never gone. It was always there. It was just in a suppressed state. The disease had just moved from a more superficial organ to more deeper organs. And when a right dose was given, it has come from a more deeper organ to the original state where it started. But as has been said, by this local symptom that silences the internal disease, so far from anything being gained by the vital force towards diminishing or curing the whole malady, the internal disease, on the contrary, continues in spite of it, gradually to increase, and nature is constrained to enlarge and aggravate the local symptom always more and more. So the same thing which we were talking about, that a local symptom, it keeps on getting enlarged and aggravated. It started from the elbow, went to the whole arm, then to the chest, then to the other arm, to the back, because the nature is trying to constrain the disease from going inside. So what it is doing is that increasing the symptoms more on the outer part, because the internal disease is also increasing. It is not curing, it is not diminishing. Although the vital force has established a defense, a buffer, that this disease should not come inside, but on the outer also it is increasing. It is becoming enlarged and aggravated, the local symptom always more and more, in order that it may still suffice as a substitute for the increased internal disease and may still keep it under. So it becomes a defense of the body, it becomes a defense of the vital force to keep the disease outside, although the whole body starts getting covered by that eczema, by that ulcers, or by any kind of local symptom which is being produced. But it does not let it come to the inside. That is a way how the body, how the vital force, it keeps a check that the internal organs or the inside of the body is protected. So old ulcers on the legs get worse as long as the internal sura is uncured. So here we have to understand that what is to be cured now in this case, in such cases, whether the local symptom is just a local symptom, the diseases, this eczema, this psoriasis, or any other kind of diseases which are persistent and from a long time, are they just local and can they be cured locally, or there is something else to it? So as a physician, we have to understand that it is the internal disease which is uncured and increasing. So as long as that is not cured, the outer symptoms of it are they are never going to go. And even if they go, they may go into more dangerous states. They can affect more vital organs then. The chancre enlarges as long as the internal syphilis remains uncured, just as general internal disease continues to increase as time goes on. So as the time goes on, the internal disease, it continues to increase. The local symptoms, they will keep on increasing. So footnote to Aphorism 201, the issues of the old school practitioners do something similar. As artificial ulcers on external parts, they silence some internal chronic disease. So in old school practitioners, the way the practice was at that time of Dr. Hahnemann, the physicians, the doctors, they used to produce some kind of artificial ulcers to let the blood out. So for that time when they used to produce that thing, some internal irritation will be worn out. So the patient will feel the relief in some kind of internal irritation, internal sensitivities, whichever they had at that time. So at that time, it was thought as a treatment for such kind of diseases, but it was not a treatment. Artificially, a disease was produced on the external part, on the local part. So the body had to respond by decreasing the internal disease and focusing on the external one. But because it was not a natural thing, it was not a natural way of the vital force. So what will happen is that they will silence some internal chronic disease, but only for a very short time without being able to cure them. They could not cure it. So it was just again a suppression of the internal disease in a vice versa way. But on the other hand, they weaken and destroy the general health by doing this, because whenever you are trying to suppress something, go out of the way, go out of the natural way, what we will do is that we will weaken the patient more and more. So by that bloodletting, by making that artificial ulcer, the patient would become more weak, and it will destroy the general health much more than is done by the most of the metastasis affected by the instinctive vital force. So that will basically destroy the health or weaken the patient in a more faster way than the vital force could have done. So if the old school physician should now destroy the local symptom by the topical application of external remedies, under the belief that he thereby cures the whole disease, nature makes up for its loss by rousing the internal malady and the other symptom that previously existed in a latent state side by side with the local affection. Now, if the physician, he somehow destroys this local symptom, he is somehow able to do this thing with some kind of external remedies, with some kind of ointments, with some kind of something which is put on the local symptom from the external way. What happens is that this is a loss to the nature. Dr. Hahnemann uses that nature makes up for its loss. That it is a loss to the nature. Why it is a loss? Although the vital force or the nature cannot fight against the disease on its own, but still it has provided a very good defense so that it remains to one single part. So when we are trying to basically uh, break through that barrier, vital force has formed a barrier that, okay, there is a disease, but it will remain in the external part. I will not I will not allow it to come inside to the internal this thing. But when we are helping the disease by applying something local, by applying some external remedy to break that barrier, so it is a loss for the nature, it is a loss for the vital force, because otherwise the disease might not have been able to break that barrier, but the physician helped to break that barrier. And what has nature has to do is it has to make up for that loss. How it makes up for that loss is by rousing the internal mind. It has to increase the disease inside. That is the only way then. It has to put it in some other organ, because now it has come inside. So as aphorism 74 tells us, that nature of the vital force is always trying to maintain the life. So it will put into some organ, one of the organs, and try to keep it there until we do something else, until the uh, treatment again is given in a wrong way. So it will basically start increasing the symptoms which were latent, and now side by side with the local affection, it will start increasing that also. The local affection will also remain, and some symptom will start increasing. That is to say, she increases the internal disease. So the internal disease will start increasing. So the more we apply for this external symptoms, the more we apply some external remedies, the more the local affection will become better and the internal disease will become increased. So when this occurs, it is usual to say, though incorrectly, that the local affection has been driven back into the system. This is suppression. The word uses driven back into the system. So the local affection has been driven back into the system. So the body had put it outside. Now with the local or the external remedies, we have driven it back into the system or upon the nerves by the external remedies. So this is the aphorism which basically tells us these are the about the suppression from the layer of the skin and how it affects our internal disease or the internal body. So aphorism 203, every external treatment of such local symptoms. That is why we give a very, like when we are seeing the patients, we always tell them that be very careful. If something comes upon the skin after the treatment, don't apply anything on it. Don't apply anything which can basically drive it again back inside. And we have seen in many patients who have used something topical, local on the skin, and their older symptom they came back. The symptoms which are getting better. Even we have this one case in Thailand. The a male patient who has this problem with the hearing. His hearing started becoming better. He applied something on the skin. I think I don't know. He had something. Maybe he applied some balm or some this local painkillers or something he applied, and his hearing started diminishing again. So that also shows us a direct link between the skin and the nerves, and that is what is told by Dr. Hahnemann also here, that driven back into the system or upon the nerves by the external remedies. There's a direct relation. And you can see that in patient, that when this kind of problems they start getting better, something will come upon the topical part, upon the external part. And if that is again, we do something again bad to it, we suppress it, it will go again to the internal part, or the symptom they will start increasing again. So it is very important to tell the patients beforehand that if you have anything, don't do anything about it. You can talk to us, you can come, you can show, but don't do anything about it. That is why, because many times that when we are seeing the patients, some doctors they ask that why you give so much importance to this, and the local some symptoms if they come up. Why in every follow-up you ask about them? That did you had any kind of some symptoms on the skin or not? This is why. This is the whole reason. So every external treatment of such local symptoms, the object of which is to remove them from the surface of the body, whilst the internal miasmatic disease is left uncured. So any kind of treatment, whether it is done by some kind of homeopathic remedy or so-called homeopathic medicines, because nowadays many the stores or the pharmaceutical companies, they are selling some arnica, some chamomilla to apply on the body, many kind of skin routines. I have seen recently that in many kind of skin routines, they have started using the this mother tinctures of homeopathy medicines to create some kind of creams. So any kind of that is why Dr. Hahnemann has said that every external treatment, any kind of, if you are using calendula, if you are using anything for external treatment of such local symptoms, if we are doing something, the object of which is to remove them from the surface of body, and the objective of such a treatment is to remove that local symptom, whilst the internal miasmatic disease is left uncured, and there is no focus on the internal miasmatic disease, and it is left uncured, incurred, because no internal anti-miasmatic medicine or any homeopathic medicine has been given to that patient, as for instance driving of the skin, the psoriatic eruption by all sorts of ointments, burning away the chancre by caustics, and destroying the condylomata on their seed by the knife, the ligature or the actual cautery. This pernicious external mode of treatment, hitherto so universally practiced, has been the most prolific source of all innumerable named or unnamed chronic maladies under which mankind groans. So Dr. Hahnemann is saying that all those diseases which have been named or even not unnamed, we don't even know about those diseases which are happening, we have not named them, under which the whole mankind is suffering. The reason, the source for that is because we have been curing the diseases from the external part, the psoriatic eruption by some kind of ointments, or some chancre by burning it by the caustics, or we are destroying the condylomata or the warts, or by the knife or the cautery or the ligature. And this has become, this kind of dangerous mode of treatment has become the source for all the diseases which are developing inside the body, all the chronic diseases. It is one of the most criminal procedures the medical world can be guilty of, and yet it has hitherto been the one generally adopted. Dr. Hahnemann is saying that it is happening in front of us, that when we are doing such treatment, the internal symptoms they start developing. We can see that the symptoms, they have become more profound after such kind of treatments. But still, it is a generally adopted treatment. Still, it is the thing which is done and taught from the professional chairs as the only one. And from the professional chairs, it is taught that this is the only way. This is the only treatment. So Dr. Hahnemann calls it the most criminal procedure. Why criminal? Because we are pushing someone towards a more hastened death. Death is going to come. One is the person will die naturally, maybe in a healthy stage, maybe in a less diseased state. But when we are hastening the process, we are uh, making the process more rapid by some kind of procedures, then definitely it should be called criminal. So he is saying that this is most of the criminal, one of the most criminal procedures the medical world can be guilty of. So the whole medical world has to come up, see what is happening in front of our eyes. Okay, maybe, although it is not, but maybe the aphorism is wrong. But we can see what is happening in front of our eyes. And when we see more faithfully in the truth what is happening, all these aphorisms will come true. You will see that every word which is written here is a very truthful thing, and this is happening. It happens in this way. So footnote to aphorism 203, for any medicine that might at the same time be given internally, served, but to aggravate the malady, as these remedies possessed no specific kind of curing the whole disease. So now many medicines are given internally, but they will aggravate the remedy if they do not have the power to cure the whole disease, if they are not given in a homeopathic way. Because many times, when some of the physicians, they started observing this thing. They started giving the same medicine internally. Sulfur applied externally, okay, no, we will give sulfur internally. But if it is not homeopathic, then it will again aggravate the disease. If it is not given in a homeopathic way, because as these remedies possessed no specific power of curing the whole disease, but assailed the organism, weakened it, and inflicted on it, in addition, other chronic medicinal diseases. For example, a patient is suffering from fungal infection on the skin, and some antifungals are given inside. They cannot cure the whole malady. So that will all again aggravate the disease. Because we have to understand, we have to cure that internal disease which is going on in the whole body, not on some local part, not on some toenails, not on some foot, not on the hand, because hand is not the man. And the medicine should be given for the man, not for the hand, not for some local part, not for the skin. So aphorism 204. If we deduct all the chronic affections, ailments and diseases that depend on a persistent unhealthy mode of living. So Dr. Hahnemann says, if we just deduct, if we remove, if we just keep them aside, all those chronic affections, which basically depend from the unhealthy mode of living, the way we are living. It is more given in the aphorism 77. We can refer to that thing also. So all those diseases which are dependent on the unhealthy mode of living, as also those innumerable medicinal maladies, and all the diseases which are basically produced by the medicines. Aphorism 74. Okay, the medical dyscrasia, if we just keep that aside, and all the diseases which are basically produced by the unhealthy mode of living, caused by the irrational, persistent, harassing and pernicious treatment of diseases, often only of trivial character, by a physician of the old school. So all those, if diseases are kept aside, the medicinal diseases and the diseases which are dependent on the unhealthy mode of living, all the remainder, whatever the remainder is there, without exception, result from the development of these three chronic miasms. So all the diseases which are remaining, they all develop from these three chronic miasms. The internal syphilis, internal psychosis, but chiefly and in infinitely greater proportion, internal sora. Each of which was already in possession of the whole organism and had penetrated it in all directions before the appearance of the primary vicarious local symptom of each of them. So when the primary symptom comes, the symptom on the local part comes, on the skin comes, before that these miasms have already possessed the whole organism. They have already seeped in, they have already penetrated in all the directions, and long after that penetration, long after that possession, the primary local symptom comes. Now, how we can understand whether they have penetrated, that is a very long discussion. I will not go into that. I have already taken this one class on the sora and the miasms. So I don't know if we have put it on online or not. I will talk with Dr. Rishabh. And I have also spoken about sora in Thailand and Brazil also in the different workshops. So that is also a very detailed thing. So maybe if we can go about it on some other day, but we have to understand that this local symptom has come long after that seeping, long after that penetration. And in the case of sora, the scabious eruption, in syphilis, the chancre or the bubo, and in psychosis, the condylomata. So these are the three basic local eruptions which come in these three basic miasms. There can be different kinds to that also again, but these are the three basic eruptions which come that prevented their outburst. So this local symptom basically prevented their outburst, although it has seeped in, although it has possessed the whole organism and penetrated in all directions. But this local symptom has basically prevented the outburst, and these chronic miasmatic diseases, if deprived of their local symptom, are inevitably destined by mighty nature sooner or later to become developed. And if this local symptom is taken away, it is maltreated, it is suppressed, then that it is inevitable that we can stop the development of the miasms and to burst forth and thereby propagate all the nameless misery, the incredible number of chronic diseases which have plagued mankind for hundreds and thousands of years. So this is not something new. This is not something new which has happened to the humankind for the first time. Aphorism 81, we can go there and we can again read it. Aphorism 81, that it has passed on from generation to generations, from thousands of years, none of which would so frequently have come into existence had physicians striven in a rational manner to cure radically and to extinguish in organism these three miasms. So Dr. Hahnemann is also saying that if physicians have striven in a rational manner, if they have uh, this understood the relation between this local symptom and the whole disease, the miasmatic disease, then the organism, or from thousands of years, the humanity would not have striven, would not have been succumbed to these kind of diseases. And if they would have worked to extinguish in organism these three miasms by internal homeopathic medicine suited for each of them, without employing topical remedies for their external symptoms. So saying that we would not have seen such kind of development of these miasms if some homeopathic medicine suited for them was given internally and the external symptoms were not destroyed by some topical remedies. So we would not have we would not have seen this kind of development of diseases which we are seeing today. Aphorism 205, the homeopathic physician. So for a homeopathic physician, now this is a pointer that the homeopathic physician never treats one of these primary symptoms of chronic miasms. So like I told you, that homeopathic physician does not cure the skin. He does not cure the ulcer. He does not cure the scabies or the condylomata. His focus should not be there, because I have spoken already about this thing, that the way you are going to cure the patient or treat the patient, it depends completely on your focus. What are we have to ask ourselves, what I am going to cure in this patient. This is a practice which we have to come up with, that okay, this is the whole case history. After taking the case history, now whether I will focus on his diabetes or hypertension or his ulcers or his psoriasis, or should I focus on him? In my follow-up, should I ask about him or should I ask about the primary symptoms or the secondary symptoms of the miasm? So in 205, Dr. Hahnemann very clearly says the homeopathic physician never treats one of these primary symptoms of chronic miasms, nor yet one of their secondary affections that result from their further development. So after the local disease is suppressed or maltreated, the symptoms which develop afterward, they are called as the secondary symptoms, secondary affections. The primary symptoms are the local disease. So we are not even curing the local disease, the primary symptom or the secondary symptoms. That should be our approach. The whole organon is to set the approach of the physician. That is why the physicians, they become successful if they can go with the approach. And that is why the physicians, they basically somewhere do not get the desired results, because the approach has not been set. So we have to set our approach, we have to set our focus, that as a homeopathic physician, what I should do. So I will not go after those primary symptoms. I am not going to treat the secondary symptoms by local remedies, neither by those external agents that act dynamically, nor yet by those that act mechanically. So I am not going to use any local agents, any external agents, any mechanical agents, but he cures in cases where the one or the other appears, where the primary or secondary symptom they appear. He cures only the great miasm on which they depend, whereupon its primary and also the secondary symptoms disappear spontaneously. So his focus is to cure that miasm, cure the whole process which is going on inside the body, because he knows that the primary and the secondary symptoms basically depend on this great miasm. So my focus is to cure that miasm. Once that miasm is cured, once it is gone, everything which is dependent on it will be gone. But as this was not the mode pursued by the old school practitioners who preceded him in the treatment of the case, the homeopathic physician generally alas finds that the primary symptoms have already been destroyed by them by the means of external remedies. So this happens with the homeopaths most of the time, that the patient, they come in more advanced stages of the chronic diseases. They are not coming when it started at that local symptom part. And many, they have forgotten about it also. Many patients, they have forgotten about, if someone used to have some boils or eruptions as a child, they have all completely forgotten until and unless they reappear. Then it strikes to them, like the patient I told you, that when the acne they came back, then it struck her. Otherwise, in the history, in her past diseases, she has not mentioned it. Then it struck her that, okay, this same kind of symptoms I used to have. So for a homeopathic physician, that is why Dr. Hahnemann has written the word alas, that, unfortunately what happens is that those primary symptoms have already been destroyed by means of external remedies, and that he has now to do more with the secondary ones. That is, the affections resulting from the breaking forth and development of these inherent miasms, but especially with the chronic diseases evolved from internal sora. So all these symptoms which are developed after that suppression, after that destruction of the local symptom, the destruction of the primary symptoms, and we have to deal with that, the internal treatment of which, as far as a single physician can elucidate it by many years of reflection, observation, and experience, I have endeavored to point out in my work on chronic diseases, to which I must refer the reader. So how we have to go through with it? He's saying that I have written in the chronic diseases, I have put many years to it, how to understand, how to, work with that thing, with those secondary or tertiary symptoms of the development of these miasms. So footnote to aphorism 2054, I cannot therefore advise, for the same reason which have been going on, that he's saying that I cannot therefore advise, I will never advise, and I cannot advise, for instance, the local extirpation of the so-called cancer of the lips and face by means of the arsenical remedy of Frere Cosme. He's saying that I will never advise that even if there is cancer on the lips or the face, that it should be extirpated, removed locally by some remedy which might be commonly given at that time, that Frere Cosme. Not only because it is excessively painful, it is very painful and often fails, but more for this reason, because if this dynamic remedy should indeed succeed in freeing the affected part of the body from the malignant ulcer locally, the basic malady is thereby not diminished in the slightest. The preserving vital force is therefore necessitated to transfer the field of operation of the great internal malady to some more important part. So he says that even in the case of some kind of cancer which is external on the squamous epithelium, some lips of the face or the face, he says that I will not advise to remove that thing with some kind of remedy, with some kind of mechanical means. He said, no, although that is painful and it often fails also. We have seen many cases of this squamous cell epitheliomas which have failed after the removal. I've seen many with that problem when it was on the tongue or on the face, that they have failed. Um, at least the cases which I have seen, uh, it always metastasized, it always increased. So he's saying that the reason for that is that why I will not advise is for the same reason. Because once, although it is very dangerous thing, although it is a more ulcerative thing, but even if you will remove the vital force, as is basically the vital force is a programmed thing. So according to its program, whenever this will be removed, it has to basically transfer the field of operation internally, as it does in every case of metaschematism. There is a very big schematic, very big programming to it, and because of that schematism, it will basically move the disease inside, and the consequences: blindness, deafness, insanity, suffocative asthma, dropsy, apoplexy, etc. So the diseases will come more dangerously in a more violent manner. But this ambiguous local liberation of the part from the malignant ulcer, that is why many times when some patients, they come to me for advice when they have accidentally found some kind of tumor, some kind of this thing, although even if they don't want to take the homeopathic remedy, my advice, if there are no violent symptoms or this thing, some kind of this thing, the advice is to just wait, because you have found it accidentally. So you didn't had any more important symptoms or any symptom which showed this thing, some kind of fibroids or fibroadenomas which were found, because once you remove it, although in an anticipatory manner, it will start going somewhere. That is a programmed thing in the body. We have to understand the programming of the body. It is the biology. It is programmed in our genes, the way the vital force has to work. So in those cases where the ulcer has not yet attained any great size, and when the vital force is still very energetic, but it is just in such a state of things that the complete internal cure of the whole original disease is also still practicable. So saying that with the homeopathic medicines, even in such cases, the internal cure is still practicable. We must proceed with that thing. The result is same when the cancer of the face or breast is removed by the knife alone, and when cystic tumors are enucleated. When some kind of tumors they are removed, or some cancer of the breast or face is removed, the same result will come. Something worse ensues, or at any rate death is hastened. The problem is, it is not that I have, like recently I had a case of cancer with, there was metastasis of the cancer. So because they have been taking medicine from the family, other members of the family, they were taking medicine from me for a long time, and they have get better in many kind of diseases, from many kind of diseases. So they had this, faith in me. So when they came for the advice, I told them according to this thing, because we have seen practically, I have seen in some of my relatives also this thing happening. In many cases when you suddenly find out about the cancer and some kind of treatment is given, the patient becomes weak very rapidly. I have seen patients who went to the hospital walking on their legs, but they never came back. They became so weak. So here also Dr. Hahnemann is saying that even that rate of death, it becomes hastened. If a patient with metastasis had only 6 months, with the treatment he sometimes only lives for 20 days, 30 days at the max, which he could have lived for 6 months. Like I told you, death is something which is inevitably going to come. When a person was born, on the same day, it was very much, written that he's going to die someday. So death is inevitable. We cannot make anyone immortal with medications. Yes, but what we can do is we can basically decrease the speed of death, decrease the speed at which a patient is going toward. We can give a more quality to the life. We can make sure that a patient does not suffer much, in such cases does not suffer much from the pains, from some kind of, that he does not become dependent upon others. We can do such things. And I have seen many patients, especially in the metastasis of cancer, like the same case which I was telling you about, that the family, the recently he died. He was diagnosed around 1.5 year back with the CA of spine, and which was metastasized to lungs also, and to the abdominal part, the peritoneal cavity. So the attendants, the son of the patient was also 76, 77 years old. So the son, he told me that, doctor, I have seen many patients of cancer in our relatives, and I was very afraid when I got to know that my father is suffering from the cancer. I was very afraid that he will suffer a lot because I have seen patients suffering. The pains, the kind of weakness and the loss of appetite and how the body is growing thin, and all those things I have seen happening to them. But he said that they didn't went for, they were taking the homeopathic medicine, and he said that the most the satisfactory thing for me was that my father didn't suffer. He was talking with us till the final day, and when his time came, he said, okay, I just want to say goodbye to everyone because now my time has come. He said that I have seen many of my relatives who have been in ventilator from 1 year, sorry, 1 month, 15 days. No one can go in, no one. So he was with us. He died in front of us, and we were satisfied that he didn't had any pain. He didn't even did, like in his word, he didn't even did this thing. So like, uh, you know, we can help with homeopathy in such cases also. See, like Dr. Hahnemann has told us, even Dr. Kent in his 12 observation, he has described about the incurable cases. Although when we approach any patient, like even such a case, when we approach, the approach is that this is a curable case. The approach, the mindset is like that. Whether it will get cured or not cured, it depends upon a lot of other things, and we will leave it to that thing. We will not try to go with that thing. Yes, our approach is that we want to cure this patient, but still, if the case is some kind of an incurable case, we can still help, with decreasing that rate, the speed at which the death will go on, and giving them relief in many other symptoms. So, what we have to understand from this aphorism, footnote to aphorism 205 is, and he specifically saying, he had taken the example of cancer because it is seen in such cases because the disease has become very violent at that time. There's a violence to the disease. And we know that it is a worst thing which has happened at that time. So what should we do? So this has been the case time without number, but the old school still goes blindly on in the same way in every new case with the same disastrous results. So we have to understand that removal of local symptoms, the symptoms which are on the local part, either it is some small eruption or a boil or some wart or some ulcer or some kind of cancer, it will always result in something which will be more dangerous than what it is. So as a physician, as a homeopathic physician, physician in general, homeopathic physician in particular, we have to keep in mind that these local affections which are coming, we have to educate the patients about it. We have to understand this thing, and then educate the patient also about this thing, that whatever will happen after the removal of this, if it is removed externally, by external means, by some kind of operations, by some kind of medicines, it will result in more bad thing. The reason is this, which is given in these aphorisms, and what we see in our clinics, in our cases, in our patient. We all have seen this thing. Whoever have seen such cases carefully would have noticed this thing without any doubt that this has happened. So with that, we will stop today's class here. There is something in the chat. Yep. Okay. Yeah, he applied some local, that patient in Thailand, he applied some local balm for knee pain, which I was telling you that he was. So Dr. Jonkol, she shared this message. So we have to understand this thing. So I will urge you again. I although already requested on the group to go through the last videos. Again, I will urge that go through these videos on the local symptoms so that it can get inside us. This thing can get inside us in our approach, that how we have to approach this thing. Many patients, they have local diseases from long time, and they want an immediate relief. We can relieve them, we can get them better, but there we have to make them understand also that sometimes it might take time. So we have to approach these cases in the same manner, that we have to understand that we have to remove the internal miasm. We have to look for the characteristics of the whole case. If the symptoms are there, look for them, some characteristics in those local symptoms. If they are unchanged from a long time of treatment, okay, and with this approach we can give the patients a chance to get cured completely, because the local application is never going to cure the patient. It is more it will, the disease is more going to go more deeper and deeper with that kind of treatment. And we should not, at least after this info, we should not do it. We should not do it. We should not tell anyone to do it. That if, okay, if you are not getting relief, then go use some ointment. No, that is a very like Dr. Hahnemann has told, that it is the most common criminal thing which the medical world has done. So we should not add into that. So with that, I will take your leave. Thank you very much, and a good night.